Honorable Douye Diri.
Thank you, Right Honorable Speaker. Honorable colleagues, my name is Diri Douye. I represent Yenagwa Kolokuma Opokuma Federal Constituency. I'm a Nigerman from Bayelsa State. Mr. Speaker, honorable colleagues, I rise to stand on Order 8, Rule 4, to suspend our rules so that we can take this very urgent matter of monkeypox ravaging my state and spreading to other states in Nigeria. Mr. Speaker, I so move. Suspected outbreak of monkeypox in Bayelsa State. Urgent need for the federal government's intervention and international community support. The House is aware that monkeypox, so named because of the first associated outbreak, was in monkeys. According to the World Health Organization, it's a relatively rare disease transmitted primarily from animals to humans, with limited person-to-person transmission. Had the last reported case in Nigeria in the 1970s. Further aware that September 22, the Bayelsa State Ministry of Health was notified of a case of suspected monkeypox. And since then, the citizens of Bayelsa State are terrified for their lives. The case was identified in an 11-year-old patient who had presented to the Niger Delta University Teaching Hospital at a place called Okolobri in Bayelsa. Also aware that according to the Bayelsa State Commissioner of Health, Professor Ebitimitula Etebo, currently the state has 14 suspected cases of different stages of recovery following treatment at the makeshift isolation ward at the Niger Delta University Teaching Hospital. Amongst these is a female medical doctor who was attending to an index case. The index patient and the medical doctor have been cared for, treated, and are fully recovered. The House take cognizance that the 55 close contacts that have been identified are being monitored as at 7th of October 2017. And whereas there is, however, no definite remedy to treat the disease, intensive support care helps patients to recover fully, while active surveillance and quick detection of cases helps to halt the spread. Additionally, the House takes cognizance that doctors recommend keeping an eye on personal hygiene, avoiding of contacts with dead animals, and the substances that their dead bodies excrete. The virus can be passed through the air, so this could pose a great danger. Washing of hands before leaving home and when you return is strongly advised. The House further takes cognizance of the fact that the predominant phrase, early indicators of an incoming outbreak, is characterized by the following symptoms: fever, headache, backache, rash, especially if it is more severe than in the case of standard chicken pox. The rash can look very ugly, frightening, and can creep all over your body. The House is concerned by the shocking admission of our own Minister of Health, Professor Isaac Adewale, that monkeypox could not be confirmed in Nigeria until laboratory investigations by the World Health Organization, WHO, referral laboratory in Dakar, Senegal, as reported in Friday, 6th October edition of the Vanguard newspapers and other news outlets. Again, concerned that the disease has spread to other states in the region, notably Akwa Ibom and just today, 6 more other states. In spite of the concerted efforts of the Bayelsa State government since the initial reports in Yenagoa, the House notes that Bayelsa State government and the Nigerian Center for Disease Control are coordinating the response in the state with support from the World Health Organization, putting the following measures in place. 1, press conferences, media briefings to allay the fears of Bayelsans and other Nigerians to dispel all sorts of ill-advised rumors. 2, advocacy visits to the traditional rulers and other stakeholders in most affected communities in the state. Social mobilization enlightenment campaigns to the most affected communities. Establishing of a makeshift isolation ward in the Niger Delta University Teaching Hospital, Okolobri, where all the suspected cases are to be cared for. Samples from 10 suspected cases have so far been transmitted to Dakar, Senegal, for definitive laboratory confirmations. Planned sample collection and assessment of animals in the affected communities. Daily follow-up of close contacts and rumors, and active surveillance and rapid case detection measures. The House, therefore, resolves to invite the Honorable Minister of Health to explain the alarming situation of how a country as vast and resourced as Nigeria will depend on a laboratory in Dakar, Senegal, to analyze samples at such a critical time of national health crisis. To explain measures and strategies the country has put in place to be more proactive in active surveillance and rapid case detection of cases for the prevention and containment of monkeypox, as well as other viruses in future, as to avert possible epidemics. To commend the quick intervention and collaborative efforts of the Bayelsa State Health Authorities, and without delay advise the Nigerian Center for Disease Control of the monkeypox outbreak, and a rapid response team has since been deployed by the Nigerian Center for Disease Control to support the Bayelsa State government in the investigation and public health response to the outbreak. To commend His Excellency the Governor of Bayelsa State for fully paying the treatment and welfare of patients of the monkeypox outbreak, and for providing up-to-date proactive healthcare system in the state. To call on the federal government to provide financial as well as logistical support to the Bayelsa State government to reach out to the threatened water-locked communities. And finally, to mandate our Committee on Health to investigate and to report back to the House within 2 weeks for further legislative action. I so move.